Here's a colored Doppler ultrasound superimposed on a grayscale image of a patient who had just recently had a kidney transplant and was having low urine output. You can see centrally, here's the hilum of the kidney transplant, that there's arterial flow going in, there's some venous drainage coming out, but there's not a lot of perfusion that we see within the cortex of the kidney. And so our differential for this could be just a low perfusion state, such as acute tubular injury. But the other thing that we have to consider as well is, does this patient have acute cortical necrosis, which can be seen in the immediate postoperative situation. And so one of the ways you can actually try to elucidate between these two is to use contrast-enhanced ultrasound. And in patients with acute tubular injury, you are going to still see contrast perfusing the entire cortex, whereas with acute cortical necrosis, we're not going to see contrast going to the outer 2/3 portion of the kidney graft itself. So here's a contrast-enhanced ultrasound that was performed. You can see contrast coming into the central portions of the kidney here. But if we look in the peripheral area, this thin hypoechoic region that isn't taking up contrast ends up being acute cortical necrosis.